DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Folks, welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. I'm glad you joined us. Dr. Matt Meisner is going to be joining us today to talk about copper toxicity in sheep, cattle, and other species. It's bound to be a great show. Thanks for joining us. Stay tuned after this break.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here.
Folks, Dr. Matt Meisner. He is boarded in internal medicine for food and fiber animals. He is the section head of the agricultural practices section here at Kansas State University's College of Veterinary Medicine, where he is an associate clinical professor. And when we get to talking about things out there in the pastures and up and down the Flint Hills and different areas of the world, copper's a pretty important element that can be both a nutrient and a toxin.
Right. Yeah, it's copper becomes one of those things where we see problems with either too little or too much. And I think today we can talk a little bit about the way it comes about being too much. And every year we'll have situations where it rise up where we'll have a bunch of animals that develop copper toxicity, and usually it shows up with sheep, and oftentimes when I see it, it turns out to be a fair number of pretty valuable, show sheep and other individuals that come about with copper problems. And it's when we talk about it, I think we can talk about the toxicity portion. It seems to be sheep almost exclusively. I mean, other species are susceptible to it, but sheep are unique in that they take it up pretty well, and then they bind it and they can't get rid of it. And so sheep seem to be the species we think about most commonly that develop copper toxicity.
Right. I mean, cattle do get copper toxicity in other species, but, sheep are like 10 times more sensitive to copper than cattle from kind of ballpark figures.
Sure. Yeah, and even when we think about other small ruminant species, goats, they're closer to the cattle and they're kind of in between there. But we see it where probably the two most common reasons that we see copper toxicity develop in sheep would be either mismanaged feed mixes, or sometimes it's just contaminants in the mixers that get it's enough to do something like that to allow them to get too much copper absorbed and then bound. And it could be feeding other species feed. We just said cattle are less sensitive, but they have more copper in their feed, and that might not be kosher with the sheep.
Especially pigs. Yeah, pigs. It's actually growth promoting. Copper can be, and so the levels we run on pig feeds are, so somebody that has show lambs and show hogs, same barn, mixing up feed, could really cause some trouble.
That's not even taking into consideration some of the plants that might be in a pasture that have a little additive. When you talk about this whole consumption thing, it's an all an additive type of a setup that we get into.
So kind of talk to me a little bit. We got about a minute here before break, but talk to me a little bit about the development of the disease.
So what happens most commonly, so there's two ways. I mean, they can either just consume a ton of it all at once, but more commonly I think what happens is they absorb it and it just keeps getting stored in the liver over a period of time. And so they store it, they bind it well, they're not excreting it that well, and this can go over for months to years, and before you even see a problem. And then usually what happens is some sort of a stressor. I think that sheep can be really stressed pretty easily, probably, but environment, handling, processing, any of those things can set that up, and now all this bound up copper in their liver just released all of a sudden, and just massive amounts in the bloodstream, and then causes acute copper toxicity to the body.
Perfect. We're going to take a break. When we come back, we'll talk about the clinical signs of copper toxicity. You're watching DocTalk.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Ashley Zondlak grew up working on her neighbor's dairy operation, and at 16, it became her full-time job. Over the years, she has shown cattle at local fairs, volunteered at Breakfast on the Farm events, and during vet school, she worked in Michigan State University's mastitis lab. After graduation, Ashley's goal is to work as a food animal practitioner.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to DocTalk. I'm here with Dr. Matt Meisner, who is the section head of agricultural practices here at Kansas State University's College of Veterinary Medicine, where he is an associate clinical professor, and he is a boarded internal medicine specialist for food and fiber animals. And Matt, it's always great to have you on the show. It's always great to pick your brain on these types of things. But copper toxicity, we led right up the break, but we have that stressful situation, animal liver dumps the copper into the body, and now things are going to start happening. What are we going to see first?
Honestly, sometimes the first thing you see are dead animals. So a client goes out and it may be one, it may be two, it may be multiple, and it may be just so fast, so rapid that you have dead animals in your pasture or in your barn or wherever they're kept. Others, what this is causing is it's just pretty much destroying all their red blood cells. Okay, so they're just all popping. So they're becoming severely anemic. They look weak. They look depressed. Some of them, to some point in time, they're breathing heavy. And since this is damaging all these red blood cells, the color, the pigment of that's coming through in the urine in some of these. So some of them would be urinating red, or we call it a port wine type of a of a urination, which is pretty severe. And this pigment in the blood cells, there's actually toxic to tissues too. So they're in kidney failure, they're in liver failure, they're having some major systemic disease that's pretty rapid.
So that's pretty obvious when you walk out, you got some dead animals, and then you start to see these clinical signs.
Sure. Yeah, I mean, and it's rapid, and oftentimes we try to treat these at this point, and we'll talk about that in a bit, but once we see in clinical signs, it's pretty hard to get them back. And so we start trying to really get a good diagnosis if we can. There's plenty of things that will cause acute death, but copper and especially sheep, we look at them. You may go out and they're pretty severe. Some of them look really yellow, so they're really icteric, so you can recognize that pretty rapidly. And at that point, that's the time to start trying to get a definitive diagnosis, meaning we can pull blood. It can be some transit. We're going to start trying to measure copper levels. That one's not the best. These dead animals, it's always good to try to do a post-mortem exam on anything that dies acutely in any situation to try to figure out what it was.
Get a veterinarian out there, have them do a post-mortem. What kind of samples are we going to take?
Particularly the best ones would be liver and kidney. Oftentimes your veterinarian, when they open them up, will recognize the problems. This is one that we call, the kidneys have a pretty characteristic appearance. I think they call it a gunmetal gray type kidney, and they're hemolysis through it. They look really yellow. So your veterinarian will be pretty suspicious right off the bat. They're going to get some samples of liver, and they're going to get some samples of kidney, and they're going to send that off to the lab. And at that point, it's also a good time to get you a feed sample, try to figure out where your sources are for this problem.
Well, so when you get them, veterinarians send them to the D-Lab, we'll get a diagnosis, and then we'll take a break now for a commercial. When we come back, it'll be time to treat them.
Great.
Thanks for being here, folks. Thanks for being at DocTalk. More with Dr. Matt Meisner on copper toxicity after this break.
I will take action against herbicide-resistant weeds. I will know my weeds, and I will stop them before they go to seed. I will do whatever it takes to give my crops the upper hand, and I will use multiple herbicide sites of action because every action counts. I will take action, this time for all time.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Matt Meisner. Dr. Meisner is the section head of agricultural practices here at Kansas State University's College of Veterinary Medicine. He is also an associate clinical professor and is boarded in internal medicine for food and fiber animals, and sees a lot of cases here, referral cases, sees some of our local cases, but copper toxicity is one of those that we do see. Those are cases that are out in the field that specifically with sheep. And so you've gotten us to the point where the sheep have built up the problem. Now we've had the clinical signs and some dead sheep, and we've sent the livers and kidneys in, got a definitive diagnosis, and now we're going to go out and treat some of these animals. What are we going to try to do on the treatment?
Right. I think that, a lot of times, like I said in the beginning, we'll have some pretty valuable individuals. This can be pretty devastating to, a commercial producer, but then a lot of times we'll get some of these pretty high-end show sheep and whatnot. So some of these, even though it's a long shot, some of these really acute cases that we're seeing, we're going to try to treat those. And we'll try some fluids, and we'll try some other drugs to try to bind up some of this copper acutely support. We're trying to keep it as low stress as possible. I've even done blood transfusions in some of these sheep that were valuable enough. And it's not that it's that expensive, but we can get pretty intense on the critical care and recognizing some of these. But like I say, the individual is hard to treat and hard to get back. And so what we're going to really do is we're going to start jumping on the rest of the herd, or the remainder of those animals that are still in the barn or the pasture or whatnot that need to be treated. And the drugs we're going to use, and your veterinarian would use, would be things that help bind copper, prevent the copper from being absorbed, bind it in the liver and help get it out, help them pee it out. And there's various drugs and chemicals that we'll use for those. Have some pretty long names and have to be used daily, or twice daily, and so you have to be careful with some of your stressors that you're putting on the animal just to get them treated. But we're going to try to we know we've got a problem, we know we have a few individuals that are having issues, and so we're going to now try to bind it and get it out of the remainder of those animals in the herd.
So when I'm looking at them, and of course we always want you to work with your local practitioner, but let's say I walk out there and I've got, looks like I've got some to triage, I've got some that are probably, they've been eating the same feed, but they aren't showing the clinical signs. Do you treat them all?
Sure.
Okay.
Yeah, you know that they're at risk. You know that you've got some, and what we might see clinical problems a year later, because this stuff binds up, and
it's building,
and so it's stored. You never know when it's going to be released, but if you have individuals, you've got others exposed.
Okay, and when we start to when you're starting to relieve this from them, how often or how expensive is this treatment?
Actually, some of the drugs are pretty expensive. Okay, but there are some sources, and talk with your veterinarian, they can call us. We have some sources where we can get reasonably priced other medications that can be given daily. There's some sources for these kind of drugs and chemicals that we can use to bind it. So it's not completely cost prohibitive for a lot of those things.
Okay. Well, we're going to take a break, and I think the next segment will be the most important, is let's prevent it and keep it from happening within your herd. Thanks for watching Doc Talk. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
As we look at one of the main components of beef quality assurance, it's the care and handling of livestock, in particular beef cattle in our case. So if we look at how we talk about that, we talk about nutrition, protection from the elements. One of the main components of that is how we handle and process cattle. The stockmanship is a key component of that. Everybody can get their cattle processed, but if we do it in a manner that the cattle are allowed to learn and actually think their way through the processing areas, it's less stressful on them, it's safer on the people handling the cattle as well. So from a stockmanship standpoint, we really try to get producers to understand how a cow thinks, how they perceive our actions around them, and how to use those two things, their flight zone, point of balance, and other aspects of behavior, to get them to do what we need them to do without stressing the cattle.
must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Matt Meisner. And Dr. Meisner is a boarded internal medicine specialist and associate clinical professor here in the Ag Practices section of Kansas State's Veterinary Health Center, where he serves as the section head. And we're talking about copper toxicity. And Matt, when we talk about, we've talked about how they get it, clinical signs, treatment, but preventing it's key.
Sure. Yeah, and so, once we've got a diagnosis, or you've had it on the place, you're going to be certainly trying to prevent it. But even if you haven't had trouble, if you've got sheep, you should try to be proactive in preventing it. One of the things on the prevention side is it's not just total copper load. I mean, there's some antagonist things that could be misbalanced in the feed as well. So you're going to look at your overall feed mixture. You're going to consult nutritionists. You're going to look at things like, for example, molybdenum and sulfur. Those kind of things help prevent some of that copper going. So that might be a situation where if you get new batches of feed, you keep them and you store them. Just so that you have it for a backup, or you go ahead and test them and see what the components of that feed are. So preventing copper from being absorbed too much in the sheep would be one thing. But nutritionists, your veterinarian, can help you balance those and look at that balance and make sure they're safe. Then we just talked about other sources. So, there's some non-traditional ways of deworming where people would use some copper oxide type or copper needles, so they're kind of slow release copper. Foot baths, there's some copper sulfate, I mean, you may be using things that I'm trying to prevent disease spread or foot care and those kind of things. And that, if they drink that, it's straight copper. Like I say, some plants, some other things. Anytime we see this whole overall balance of issues, we try to limit those sources and limit the amount of copper that gets absorbed in the animal.
I think that the getting the feed samples, storing those back, keeping those in a freezer so that whenever you do need to have something analyzed. But I go ahead, if these are valuable animals, and I don't know any animals today that are producing protein or wool that aren't valuable.
Right. Yeah.
I'd be sending those samples in and getting a good copper, get a good chemical analysis of my feed that I'm offering these animals anyway.
Right. Yeah, and like I say, what was planned on going into that mixture might have been okay, but we talked about there's sometimes some contaminated mixing equipment. There's other portions or parts of that feed that go in that sometimes just naturally contaminated with copper. And so each one's going to be a little bit different. So it's always good to just have a sample tested beforehand. You know, storing it's fine because you may not see problems until 18 months later. So, you know, it's a long time.
And most every co-op will send the samples.
Sure. Yeah, and it's, then and looking at that overall balance, and it's never a malicious thing, you know, makes it just an accident oftentimes.
You bet. Well, thanks for being here today.
Got to be here.
Thanks for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know more about what Dr. Meisner and I do here at Kansas State University's College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk today. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.